Hello, and welcome to DeSera Clinical Education's Infectious Diseases podcast. I'm your host, Kimberly Miller. Today's episode discusses the nuances of pneumococcal vaccine recommendations, including how epidemiologic changes necessitate new vaccines and considerations for vaccine selection. In today's episode, I'm joined by Drs. Richard Colgan and Brenda Tesini. To view the full educational program, please visit the show notes for this episode. Now let's get started with Dr. Colgan.
Hi, my name is Richard Colgan. I'm a family physician, professor emeritus from the University of Maryland School of Medicine, Department of Family and Community Medicine. My clinical background has been both outpatient and to a lesser extent inpatient for close to 40 years.
And hello, I'm Dr. Brenda Tesini. I'm an adult and pediatric infectious disease physician at the University of Rochester Medicine, where I'm an associate professor of medicine, pediatrics, and community health. My clinical practice is now predominantly inpatient, and I also focus on infectious disease surveillance trends in our region.
I think what's interesting is that with changes in FDA and CDC and vaccine recommendations, there's been this waxing and waning atmosphere about desirability of getting vaccines. And unfortunately, there are still new vaccines that are coming out that help us make up the deficit for where we need to acknowledge changing serotypes. The pneumococcal vaccines are a great example of that. And what comes to my mind, most recently, we learned of the unfortunate death of Kyle Busch in his early 40s from pneumonia and sepsis. And that kind of made me think about, how pervasive this problem is and, how important immunization is, even when one thinks they're young and healthy. What do you think, Brenda?
Yeah, I completely agree. I think it speaks to our definition of healthy versus at risk of these serious infections. I also think back to patients I've seen recently, relatively young adults who, themselves and their family considered healthy and are in the hospital with meningitis from pneumococcal infection. And I think most people in this younger adult, but age group, but do have underlying conditions that put them at high risk, have no idea. They really don't know that they're at risk for such a serious disease. So it is great to see ongoing attention to continue to address how pneumococcal disease changes in terms of the specific serotypes causing infection in different age groups, and that there still is robust research and development going into making new vaccines to match those.
And, kind of cutting to the headline news here or the breaking news is, I think, the fact that with one of the newest pneumococcal vaccines, it's directed more towards older adults, whereas previous pneumococcal vaccines have been almost a smattering of young and old. And I read with interest how, the newer vaccine addresses specifically serotypes that are more important and prevalent in older individuals.
There's the PCV21 isn't even approved and used in pediatrics. It's designed specifically at this point for older adults because we were seeing a shift in new serotypes impacting this population. So majority of infections in older adults were caused by serotypes not contained in the vaccine we're giving children and increasingly giving adults at risk as well. So this has really, I think, changed how we can approach this issue of changing serotypes, and now gives us, we have kind of two highly immunogenic vaccines that can be given to different populations. And between the two of them, cover really vast array of serotypes that cause disease. I think the newest one, the PCV21, covers around 80% of serotypes that are currently causing disease in adults, whereas PCV20 still covers a fair bit. It still covers around 50% of those serotypes.
I'd like to bring up, for me, what I think is the 800-pound gorilla in the room, at least as far as being a busy clinician in the outpatient setting. And that is when these new vaccines come out, be it pneumonia or other vaccines, the different COVID vaccines, influenza vaccines, for example, it's very confusing to the in the trenches clinician, or at least maybe I'm just speaking of myself, but with so many vaccines that are out there and with different indications, and one is more so for this group and the other is for that group. What I was thinking about as being perhaps a great aid would be to install an application on your phone where you can easily look up what the latest recommendations are. And I know that I believe that the CDC does have an app where you can look up what someone's desirable vaccine might be.
So I have used that, the CDC, I think they call it the Pneumorex, where you can do walk through it, and they have an app that you can download that specifically kind of goes into what's your patient's age, do they have any of these conditions, what's their prior pneumococcal vaccine, and it will spit out what you should get.
Another thing that kind of surprised me, I was, I guess, a little bit surprised, but glad to see that the CDC has kind of listed specific risk factors for severe pneumococcal disease. I mean, certainly you could, or I could guess, COPD, asthma, diabetes, chronic heart conditions, immunocompromised state, et cetera. But frankly, I didn't realize that, young children under 5 attending group child care, frankly, I didn't realize that, even demographic factors like African American and Alaska Native people, or those living in communal settings, was a risk factor. I mean, I think, we could all understand that cigarette smoking and alcoholism isn't good for your health in general, but I didn't know that specifically it was a risk factor for severe pneumococcal disease. But, a recent study showed that pregnant women are not getting vaccinated adequately against pneumococcal pneumonia. And the study looked at 492 pregnant women and observed that 1% of eligible women received pneumococcal vaccination during pregnancy, and 7.7% were up to date with vaccination. So I thought that was, interesting and important, that pregnant women may be at a greater risk for severe pneumonia because of the immunologic and physiologic changes that occur during pregnancies.
Yeah, and I think that really highlights how I think the latest statistics are that only a third of adults at risk for severe pneumococcal disease have gotten the vaccination. And I think it's that they don't know, and even their providers don't know.
Yes.
It is a really wide group of risk factors. It's not just your severely immunocompromised or, severe heart and lung disease that put you at risk. And of the estimated 100 to over 200,000 hospitalizations of adults, we're not even talking kids, of adults hospitalized with pneumococcal pneumonia, 90% of them do have one of these risk factors identified. And that's what really drove the vaccine recommendations. And lowering, one of the most recent changes to adult recommendations is also lowering the universal vaccination age-based vaccination recommendation down to 50.
Yes.
And I think that is fantastic and really meant to address some of the health disparities seen in pneumococcal disease. The peak rate of hospitalizations for adults who identify as Black was in the 50s.
Yeah.
As opposed to adults who identify as white just continued to increase with advanced age. And so it was really meant to help capture these high-risk groups and hopefully reduce some of the disparities we've seen.
Yeah, that is kind of the breaking news, isn't it? That the vaccination pneumococcal vaccination is recommended now for adults 50 or older. And then, like I mentioned, those risk factors, I noted too that the recommendations are that if you're between 19 and 49, with some of the risk factors that I mentioned, that's also another indication to be vaccinated for pneumococcal pneumonia.
Yeah. And so I do think, getting back to the elephant in the room, I do think the recommendations now are a little bit easier to, by reducing that age to, universal vaccination over 50, and spelling out these risk factors, a lot of which now with electronic health records can be pulled and primed for clinicians or office staff to kind of flag that these patients would likely benefit from pneumococcal vaccine. So I think that's helping a little bit. And now with the, just give like one and done conjugate vaccine of the PCV 20 or 21, I think that's helping a little bit reduce that.
I would assume that although we like to give shots in our own primary care office, I would assume that all of these newer vaccines are available in your big pharmacy chains, don't you think?
Yeah, I would agree. And I love the concept of partnering with your local pharmacies, because again, that trusted provider recommendation is the biggest factor associated with someone actually getting vaccinated. So that still needs to be bridged with getting the even if they get the vaccine elsewhere, discussing it, recommending it is still what's going to promote that. But yeah, the ease of just, in our region, you're in your grocery store and you can just, while you're doing your grocery shopping, pop over and get your vaccine.
Brenda, would you say that for older adults or those with some of the chronic health conditions we've talked about, that the 21 would be more favorable than 20?
I do think in most areas of our country, the serotypes included in 21. So these are areas where we actually have active surveillance going on to know what serotypes are causing disease in different age groups. So it's not 100% across the country, but in majority of the country, you are going to see more cost effectiveness and better health outcomes from giving the 21, because it's going to protect against the actual serotypes that are circulating and causing disease in older adults. There are some interesting exceptions in areas of the West where there is active surveillance, and particularly in Alaska and other areas that have active surveillance, Oregon, New Mexico, Colorado, and the Navajo Nation are seeing high rates of a specific serotype that's in PCV 20 and the previous iterations of PCV vaccines. That serotype 4 is the specific one that is causing high rates of disease. And so in those circumstances, you're probably going to get better bang for your buck using the PCV 20. Mm-hmm. There's also specific populations. Most notable is people experiencing homelessness, that you see much higher rates of invasive bad pneumococcal disease from that serotype 4. So certainly if you're coupling some sociodemographic risk factors and geographic risk factors for having high rates of serotype 4, then you should use 20 if it's available. But unless that's present, 21 is probably going to do the best work for you because of the serotypes that are included in it.
I have a question. Generally speaking, in an otherwise fairly healthy older individual, if that person's already gotten the pneumococcal 20 and the pneumococcal PPV, is there any reason to get the 21?
No, I really don't think so. I don't think you're going to get that incremental increase. And so if you use the kind of calculator guideline thing too, I think it'll say to not give it. Mm-hmm. The times where you do want to still give 21 or even 20, if you're in one of those scenarios or that's what's available to you, is if you only ever had the polysaccharide vaccine, or you've only ever had the what had previously been recommended conjugate vaccine, the PCV13. So if you've only had one of those, one doesn't give you enough protection. You do still want a 21 or a 20. But if you've already had both of those, as was the recommendation for a while, but honestly was like hard to fit in all those doses for most people, then you don't need any more protection from the 20 or 21.
It sounds like the biggest news is the fact that there's additional pneumococcal vaccines available. There's newer vaccines that address serotypes that heretofore we did not realize are as dangerous and illness-producing than before, and that this advance in pneumococcal vaccination, I guess, so important that in part the indications for vaccinating adults has now been lowered down to 50 and even lower than that, 19 to 49, I think, if somebody has some serious chronic health conditions. So I think for me, those are the major messages on the most recent advances in pneumococcal vaccines. What do you think, Brenda? Anything to add to that?
Yeah, I completely agree. We have an exciting new tool that really does target what's causing disease in older adults, as well as a newer tool to use in pediatric patients. And between that coverage across, I think we're very hopeful to see a bigger reduction in disease, pneumococcal disease, across the population again.
Thank you, Dr. Colgan and Dr. Tesini, and many thanks to you, our listeners, for joining us. To view the full program, please click the link in the show notes. To get access to all of our new podcasts, subscribe to the Tesini Clinical Education Podcast on Apple Podcasts, Google Podcasts, or Spotify. Thank you and have a great day.